Oh my god, I love it.
Lydia, it's nice to meet you. I'm Andrew Hogg. I'm the doctor here doing all the cosmetic work for Prime. So why don't you tell me a little bit about what we can do for you? What kind of things are bothering you?
I'm here today because under my eyes really bothering me. Quite hollow, the darkness seems to be getting a bit worse. I don't feel confident. What I see, makeup doesn't really cover it. I've tried the creams, but nothing is making any changes. So I'm here to talk about tear trough, if possible.
Yeah. Okay. Well, it's a popular treatment. As we get older, one of the fat underneath our eyes, for some people it bulges outwards, it sags, and that can cause a tear trough. Some people do naturally have a tear trough under their eye anyway, and certain skin types, certain ethnicities are more prone to having tear troughs under the eye as well. It's an area of the body that's got one of the thinnest, that has the thinnest skin. So the slight discoloration that you see underneath the eye is a combination of a couple of different factors. One is that the skin is just very, very thin, so you're actually just seeing the discoloration because of the muscle there. The other factor is that you're having a little bit of hollowing, which causes some shadowing. So what a tear trough treatment can do, that is with a dermal filler, is it can restore that volume loss. Okay. However, it won't change the colour. It won't necessarily change the colour of the skin. Okay. So it will help to reduce the shadowing through the hollowing that you have, but not the colour per se. So you'll find that it should help in that respect. So tear trough treatment, we use a dermal filler called tioxane. You'll find it should last in the region of about 9 to 12 months. Some people more, some people less. So in terms of the procedure, I'll first need just to run through your medical history, just talk about the risks and side effects. Then we'll go through your past medical history, just make sure that we're not missing anything important. We'll do the consent form. Now moving on to the treatment, we'll give the skin around your eye a swab with an alcohol-based cleaning agent, just to try and minimise the risk of infection. So some clinics, they do use injection points along the eyelid. I must say I prefer to use a cannula myself, as I feel there's less risk of bruising, less risk of bleeding associated with that particular technique. We'll need to make a very slight puncture with a needle just on the outside of your cheek here. And we use a long cannula, which is a blunt needle essentially, to just inject a small amount of dermal filler underneath the eye. Okay. Have you got any questions about tear trough treatment?
Yes, is it going to hurt?
That's a good question. So in terms of injections, there's just one injection point, which is at the outer portion of the cheek, and the filler that we use contains an anaesthetic within it. So there's a little nip to start with, but after that you shouldn't really feel anything. There might be a little bit of pushing, but you shouldn't feel any discomfort after that.
Okay, so you don't put the numbing cream on first?
It's a good question. I think numbing treatments are suitable for certain types of procedures. I think in this particular instance, because it's just a single injection, a single needle rather, a single entry point, then the benefit from using topical anaesthetic creams is pretty modest, to be honest. So I find in most instances it's not necessary, because the anaesthetic from the actual injection itself, that's combined with the dermal filler, usually does the job.
How long is it going to take?
The actual treatment itself we do within about 5-10 minutes. Yeah, so it's not very long. Yeah, we spend more time talking about it, going through the consent and the medical history, than we do actually doing the procedure itself. But that's an important element of the whole process to make sure it's safe.
Okay, cool. And is it going to help me with my, like if I smile? Like in photos, I really have it's like a bulge, like a pouch. Is that like all eye bags?
Let's have a look. Let's have a nice big smile, big teeth grin. So you have got some fine lines either side of your eye here. Tear trough treatment probably won't help for that because it's a little bit further out. So you would probably be looking at things like botox for that sort of problem. Yeah.
Okay.
Yeah. Okay.
And am I going to walk out with black eyes, or am I going to just like?
That's a good question. So, as with any medical procedure, there's always a potential for side effects. So, the main one in this context is bruising and swelling afterwards. That's always a possibility, particularly with tear trough treatments, as there are lots of fine vessels around here. But like I say, we do use a cannula to try and minimise the risk of bruising, but it's always a possibility. It's always a possibility. But that is usually something that will settle down over the course of a week.
Okay.
But it's unlikely you'll look like you've done 5 rounds with Mike Tyson.
Okay, that's good.
But it's usually fairly mild in nature.
Okay.
Yeah. Okay.
Obviously, you're a qualified doctor. Like, how long have you been doing this type of procedure?
Yeah. I've been doing facial aesthetics for about 8 years now. I am a registered doctor, so you can look me up on the GMC website and see Dr. Hobbs there. I'm fully insured through Hamilton Fraser, and I've been doing these procedures for a number of years now. I think one of the key things about doing these sorts of procedures is knowing the anatomy. So I've been on the relevant training courses, and it's important to have that knowledge in order to try and minimise the risk of complications. I think one of the key things about facial aesthetics is that there are people out there who are practicing who have no qualifications whatsoever. So it's important to ask those kind of questions to make sure that you know who is it that's on the other end of the needle that's doing the injecting. So it's a good question.
When I've seen before and after pictures of people, their the darkness, that bruising looking thing, it always looks less after they've had the tear trough filler. Because I know you're saying it's not going to get rid of that because it's the skin pigmentation.
Yeah, well,
is it just to do with shadowing?
The darkness is usually a combination of things. So if you look at Asian skin types, for example, women from India, they naturally often have a darkness around their eyes.
Yeah.
Okay.
Yeah.
And that is often exacerbated. The tear trough is exacerbated if they do have bulging of this fat.
Yeah.
So you might get rid of the of the hollowing. Okay, but you can't change the skin colour through the actual dermal filler itself.
Okay.
So we've got a slight hollow. Okay, we've got some slight purple discoloration because the skin is quite thin, and you're looking at the muscle that's lying underneath it.
Right.
Okay, so what we're doing is we're lifting that up, but you've got filler, you've got muscle, and then you've got skin.
Yeah.
So the filler's going underneath here. So we're not changing the actual.
Underneath the muscle.
Yeah,
okay.
But we're not actually changing the skin tone itself.
And the last thing is, what should if there are any side effects I should be concerned about?
There's always a potential risks of side effects. Some are just associated with sticking a needle into the skin. Some are associated with the filler itself. So, in terms of the needle, bruising can happen. As I say, it is one injection point, which we do a bit further away from the tear trough, and then we insert a cannula up into this area here. I have had 1 or 2 clients that have had some bruising afterwards, a little bit of swelling, but it almost always settles down over the course of a week. There are some people who get longer term swelling that may take several months to settle. That's a risk, but I've never had that happen with all my dermal filler treatments. Allergic reaction is possible, but it seems to be very rare with dermal fillers. Essentially, this is a synthesized version of something you already have in your skin anyway. So it's something called hyaluronic acid, which is what you have in your lip, which naturally exists in your skin. But with the dermal fillers, they have these little cross linkages attached to them to stop it from degrading. Okay. So the risk of allergies seems to be very, very low with dermal fillers. Infection can happen. I've been doing aesthetics now for about 8 years. I've never had infection so far. I did have a lady who had a cold sore after a lip filler treatment, but she was naturally predisposed to cold sores anyway. itching can occur. Discoloration if the product is placed too superficially, but we're aiming to place this product just on the bone, so it should be underneath the muscle, so it should be visible. Now, there are small risks of some more serious complications associated with using dermal fillers. The worst one is, as you say, is blindness. Now, there's been about 5 cases reported blindness associated with tear trough treatment.
Whatever?
Yeah.
Okay.
So it's fairly uncommon. In my mind, it's likely to have been through aggressive injection using a needle, and also not aspirating the needle before you inject. You should always aspirate to check you're not into a vessel before you inject. So a lot of it is down to technique, okay, and knowing your anatomy before you do it. Right. Lots of blood vessels in your face generally.
Yeah.
The main one underneath your eye is called the infraorbital artery, which is a small vessel, but again, we're going to be using a cannula and we'll be injecting medial to that, so on the other side of it. So, and as I say, I'll be aspirating before I inject. So, again, if you have studied your anatomy and you know what you're doing, then the risk of that should be low. It's always theoretically possible, but the risk should be low. As I say, you can set up shop, buy some dermal fillers, and say, I'm a facial aesthetic specialist with no qualifications whatsoever. So, necrosis leading to a permanent scar is essentially if you damage a blood vessel that supplies a particular area of tissue, then it loses its blood supply, and that can cause breakdown of the skin and scarring. Now again, that has never happened in 8 years or so of facial cosmetics, and is down to technique. If you're not sure what to do, you don't know what you're doing. Okay. So if there were damage to a blood vessel, you might have pain. It would normally be obvious at the time of the procedure. The skin might blanch, it might turn white, it might be uncomfortable. We would just stop immediately. We do have drugs in my bag that we can use to treat that if required, to break down the hyalase, to break down the hyaluronic acid. There's a special drug called hyalase, which basically dissolves it to try and minimise that problem.
Okay.
So if we were to write a sentence about what you'd like to achieve, it's good practice just to write a sentence. What would you say you would like to put?
I would just like an improvement. I'm not expecting it to, vanish. But I'm just like an improvement in like the hollowing and the shadowing and stuff, because that lost me.
Right, so this is the actual consent form itself. Do have a read of that, and let me know if you have any questions. If you don't, just tap and sign on the left hand box. If you do, let me know.
Okay.
Right, are we good to go? That's the actual needle, the cannula.
Is that a nervous patient? Are you nervous, or are you alright?
I don't think so.
Try not to.
I don't think so. Right, are we good to go? Alright, just turn towards me slightly. Right, okay. Slight scratch. So, on this side. Okay. Right, now you might feel a bit of pushing. You might feel a little pop. No, the canyon's not in there.
Oh.
Okay. Ready to sit up for me? Just sit yourself upright. And look up to the ceiling. And down. Chin down a little bit. Okay, back again. We've only used half a mil. Yeah, not much, to be honest. Following here, you had a bit of flattening here of the cheekbone. Although you've got good cheekbones here, you've lost a little bit of fat underneath your
So just age, just drops.
The fat underneath the eye here, it becomes thinner and it drops like that. Yeah. Okay. A little bit of bruising here, but that will settle. So I think overall we've got quite a nice result.
Wow! Oh my god, I love it. Like, honestly, that is amazing.
Yeah, it's great. It's such a great treatment. You know, it's instantaneous results.
I can ignore the bruises and I can see that.
I mean, you'll obviously, you've got a little bit of bruising where the injection sites were, but that will settle down. But we've restored a little bit of volume just underneath the eye as well as the tear trough.
Do I look younger? I feel like I look younger.
Beautiful.
Or is it just all psychological? No, that's definitely.
Yeah.
Oh my god, that is actually amazing.
Great. Fantastic.
It wasn't even that painful either. Like, it wasn't painful. I think it's just this thought, for me, it was the thought of the needles and cannula, but
I think anything around the eye.
Pain, there was no pain.
It's understandable.
A bit of pinprick, but no.
Yeah. Fantastic. Great. Well, look, you've had your treatment done, the bruising will settle, we'll look to be seeing you in about 2 weeks' time.
Okay.
And see how things are. But if there's any problems in the meantime, just give us a